Hey there, I'm Trevor Wicken, creator of the MS Gym. I created the MS Gym for the MS community, and I created the MS Gym for you to help you learn how to effectively exercise with MS, how to use exercise to manage your symptoms, how to use exercise to literally feed new movement patterns into your brain and in your body so it can learn how to work around the lesions in your brain and the demyelinated nerves in your body. The overall goal of the MS Gym is to slow down the progression of MS using the power of movement training and building you an MS movement practice. So thank you for being here today. Now you're in part 3 of a series that we're doing on using stretching to reduce spasticity. And this is, I would call this 3A because today what we're going to be talking about is reducing flexor spasticity at the knee, okay? In the next video, we'll be talking about reducing extensor spasticity in the knee, okay? So let's get started. Okay, so with a flexor spasticity, let me move back just a sec. What happens is that the muscles that flex your knee or bend your knee, and I'm just going to talk about the knee today. There's other stuff that's going on, but we're just going to focus on the knee today. What happens with that is that your hamstring gets super duper tight. So the overactive muscle, the spastic muscle, is the hamstring. And typically it is the biceps femoris, okay, and the lateral portion of the gastrocnemius or the calf. So these two muscles right here are the overactive muscles. The underactive muscles are typically going to be your vastus medialis and your quadricep muscle. Those become super duper weak with flexor spasticity in MS. Sorry, something just fell over there. Scared me. So anyway, so what we're going to do is I'm going to go through the RISE method, the rebalancing part of the RISE method to show you how to inhibit these muscles and basically calm them down through manual massage. Then I'm going to show you how to go through and lengthen those same muscles, because once we get them inhibited, we want to lengthen them. And then we'll go through an activity and an exercise to actually counteract that spasticity and strengthen the muscle in your knee, okay? So let's get started with that massaging of your muscles through here. Okay. So what we want to do, you're going to find your hamstring tendon right here, okay? So this is the tendon of what's called your biceps femoris, or your outer hamstring. You can see my quad right here. Then there's my biceps femoris. So it's going to be the muscle. It's going to be right under there. So the muscle belly is right by that tendon. So what you're going to do is you're going to use your hands. You're going to reach over the top, and you're going to find that tendon, and you're going to kind of just dig through there until you find a spot. And it's typically kind of underneath in that muscle belly. So you're going to find this, okay? Now with your flexor spasticity, you may not feel good to sit like this. So you may need to sit up tall. You may need to rest your leg on something while you are working on this, like a blanket or a pillow or a cushion. I'm just going to hold it up for now, but you can't get to that muscle when it's all bent up anyway. So you're going to have to do this. Now, if you start to feel flexor spasticity in your hip, you may need to lean back a little bit as well. But what you're going to do is just get in, and you're going to find a spot that's like, ooh. And if you're spastic in your hamstrings, you will know it, okay? So you're going to find that spot. You're going to rub that out for about 30 to 45 seconds. You can switch arms and then kind of switch hands to give your arms a rest as you're doing this. So you're going to release that biceps femoris about 30 to 45 seconds. The second one we're going to do is right on the edge of the calf. So you can see this muscle right here on the calf. You're going to find this bony portion right here on your shin, and you're going to work your way kind of down, like to the side and down through what's called your lateral gastroc or your lateral calf, okay? So that muscle comes up and it actually flexes the knee as well. So you want to find, ooh, that's a party right there. That's awesome. Okay, so there's a party. Find your party and then just dive into the party, man. So you're going to take that and you're going to release it. If to give yourself a break, you may need to come underneath and kind of work yourself underneath here. So you can see my thumbs are under this way. So you may need to come underneath and work that gastrocnemius too. So you want to get about 30 to 45 seconds on that as well. And then you're going to head into your stretch, which we'll cover next. So now we're going to go into a stretch for these two things. So what you're going to do is you're going to lie on your back, okay, just like this. So let me scoot and make sure I'm okay here. Let me make sure you can hear me still. Okay, you can hear me. So what we're going to do is you're going to drop your back leg down, okay, or your inside leg down, and then you're going to take this leg and you're going to put the heel right on top of your thigh, okay? Now, if this causes any kind of spasticity, just don't go down as far, but you're going to kind of just hold it there. You're going to take the opposite hand, so this is the hand closer to the wall, and I'm going to reach across and I'm going to hold the muscle that I'm trying to stretch, okay? So you can see, so like my heel is on my quad and I'm holding my body here. If you can't get that arm all the way around, just kind of hold your leg, or if you need to, grab something like this belt, and then you can actually hold your leg this way, all right? So you can kind of pull your leg back here and just kind of hold that and relax. So, because I don't want you all flexed up like that, because then that could send your upper body into a spasm. So what you're going to do here is hold your abs in. I want you to tip your pelvis back, so push your low back onto the mat, and then all you're going to do is you're just going to kick your leg up at a 45-degree angle, pull those toes back just a little bit, and you will feel kind of a nerve burn through here. That's okay. Bringing it back down nice and slow. And I want you to do 10 of these. So you're bringing it up. It's a 1, 2, pull that toe back and back down, or pull that foot back and up. 2, 2, bringing it back down, and make sure that heel touches your quad every single time, okay? 3, 2, and also make sure that you're not rolling too much. You want your butt or your sacrum on that mat, okay? Hold it. 4, 2, back down, just relax those shoulders, pull those abs in. 5, 2, we'll go, what's one more? And then I think you got it. So you want to do about 10 of these, and hold it for about 2 seconds and bring it back down. And what this is going to do is it's going to stretch your biceps femoris, your calf, the lateral calf, your ankle, and also open up your sciatic nerve. So if you have back pain or you have sciatica, this is going to help out as well, okay? So we'll go one more, bring it up, abs are in, 1, 2, bring it back down, remove that rope, and then repeat 10 repetitions on the other side, okay? So that is, ooh, my necklace popped out. So that is what you want to do. You want to release the biceps femoris, or the outer hamstring, release the outer calf, okay? And then you're going to stretch that outer hamstring and that outer calf, all right? So let's talk about quad activation next. Okay, so when we talk about flexion, obviously our flexors, our knee flexors, are the ones that are overactive, okay? So what do we need to do to combat knee flexion? Well, we need to go into knee extension, which means straightening our leg, okay? So what I want is for you to, if you need to, you can get like a rolled up towel or something like that if you need to get into there. But what I would recommend is that you actually try to push your leg down, because you already have flexor spasticity. So if you let your body go into flexion, it may not work very well, okay? So I want you to try and do it without a bolster or anything under your leg. If that's really uncomfortable, just put it up a little bit, but don't send yourself into a spasm. So you're going to put your arms behind you, you're going to pull those abs in and sit up nice and tall, and then in order to do this, I want your legs straight out, and this is a very small motion. So I'm going to move this leg aside so you can see that toe is pointed straight up at 12 o'clock. You're going to pull those abs in, shift back just a little bit, and then what I want is you to just lift your foot off the floor by squeezing that quad muscle, okay? I'm not trying to show you my leg, but I want to show you the muscle contraction. So toe, maybe you like my leg, I don't know, right? So toe pointed straight up at 12 o'clock. Watch this foot right here, so watch right there. So abs are in and lift, boom, 1, 2, bring it back down slow. And you want to make sure that that toe doesn't turn out or turn in. You're going straight up, 2, 2, back down, okay? Abs are in, 3, 2, relax your shoulders. I don't want to see you down like this or way up here. Don't hyperextend your elbows. Back down, just nice and easy. 4, 2, back down. 5, 2, and you should be feeling that right through here. Back down. 6, 2, back down. 7, 2, back down. 8, 2, back down. Give me 2 more. So this is the pace you want to go. 9, 2, back down, and 10, 2, back down, okay? So you should really be feeling that kind of firing up in that quad muscle, and once you get these muscles out here relaxed and stretched out, you're going to be able to use that quad muscle a lot more. Now, if you're just starting this and this is day 1, this may not work super duper great yet. So I just want you to keep the faith. It will happen, and here's a little trick. If you can't lift your leg very much, use help, okay? So what you want to do is you want to get right here and hold this just like we were doing on our ankle drill, Okay, you're gonna hold those abs in, and then if you're gonna lift your leg, you're gonna try to lift it and help yourself. Just kind of pull it up and then let it come back down. Pull it up and let it come back down. But like, it needs to be as little as possible. You don't want to just crank the leg up and say, look, I'm doing it, Mom. You really want to just pull it back first and then just lift and barely help yourself, just enough to get it off the ground and help yourself out. Because just by thinking about it and helping yourself do it is feeding the pattern in the brain to teach it how to go into extension, get out of flexion, and help you out while you balance, while you walk, while you do all your other stuff. All right? So I hope this helped you guys out. Go, if you have extensor spasticity, then watch the next video. I'll see you soon.